Hey guys, welcome back to my channel. I'm Crystal Divine. This is my indigenous lifestyle, and today I'm going to talk to you guys a little bit about Lotus births, okay? I did not have the pleasure of experiencing a Lotus birth firsthand, but it is very interesting to me, and as a future doula, I cannot wait to just experience a client who desires to have a Lotus birth. So for those of you who don't know anything about Lotus births, this is the video for you. I'm not gonna go real deep into it, but you will at least have some basic knowledge of a Lotus birth after watching this video, okay? Now before I get into it, I want to tell you to subscribe to my channel if you are not already. And if you are already subscribed to my channel and you're coming back to watch another video, I appreciate you so much. Thank you so much for the support and the love. I appreciate you. Alright, so let's get into it. A Lotus birth is simply when you leave the umbilical cord uncut after you deliver the baby, so that the baby is still attached to your placenta. Your umbilical cord will naturally separate from your baby's belly button, and this takes anywhere from 3 to 10 days after you have given birth. The cord separates because it begins to dry and shrivel up, and then it basically just falls off. So that is what a Lotus birth is. After you give birth, you do not cut the cord, you push out the placenta, and you leave the baby attached to the cord and the placenta until it naturally just separates from the baby. This is an alternative to what normally goes on into the hospital, which is cord clamping. Cord clamping is basically what it sounds like. You know, they clamp the cord and they stop the blood flow from circulating from the placenta through the umbilical cord to the baby. They do this within a matter of minutes after the baby is born, and they also clamp the cord to detach it from the placenta part. And the whole point of a Lotus birth is to keep the baby intact with the placenta and to just give the baby a smooth transition into the world outside of the mother's womb. It is said to be a respectful transfer of attachment without the trauma of being cut from the mother. Now, the name Lotus birth comes from the lotus flower, which represents unity, it represents detachment, and it also represents rebirth. In Western nations where we are, Lotus birth is considered to be a new trend that is on the scene, but this is actually a very ancient and sacred practice that has been going on long before hospitals became the go-to place to give birth. I believe that what is starting to attract people to Lotus births is the lack of intervention that goes along with this. And y'all know in the natural birth world, we love a lack of intervention, especially medically. Overall though, it's meant to be gentle and safe for the baby. It's a spiritual practice that honors the relationship between the baby and the placenta. But you know, if a Lotus birth is not the way that you want to respectfully handle this spiritual practice, there are other things that you can do. Some people like to bury their placenta, give it like a ceremony. All right, so now I'm going to talk a little bit about Lotus birth versus delayed cord clamping. Okay, delayed cord clamping is when you basically wait. Earlier I said they do it in a matter of minutes. Delayed cord clamping is when you basically wait for the blood to flow through the umbilical cord and then clamp it. This is more recommended globally. My personal experience with cord clamping, my first 2 pregnancies, I was drugged up and out of it, so I don't even know what they did. But my last pregnancy was a natural birth experience, and I remember specifically telling them to delay the cord clamping And once all the blood went through, I overheard the nurses talking to each other. You know, they were saying like, well, do we still take a sample of the umbilical cord if there's no blood in it? And then the other nurse said, well, just send it anyways. She was kind of like, they'll figure it out. And so that was like real interesting to me, that hospitals like to take samples of our umbilical cord while the blood is still in there. I don't really know what that's about. I didn't really ask any questions because there was a lot going on, but I do specifically remember hearing that. And I also wanted to keep my placenta. I told them that I was going to keep my placenta and turn them into capsules. But I did a little bit of research on what benefits could come from delayed cord clamping, and I'm just going to read them off to you really quick, okay? So, let's see. Increase in hemoglobin levels, improve iron stores over the first few months of life, improve red blood cell volume, improve circulation. It can decrease the need for blood transfusion. It can decrease the risk of necrotizing enterocolitis and intraventricular hemorrhage. So those are some of the benefits of delayed cord clamping. There is a slight risk of jaundice with delayed cord clamping, but the pros are supposed to outweigh the cons with that one. Now back to Lotus births, because that's what we're here for, that's what we're talking about. There's really very little research that has been done pertaining to Lotus births, so there's not a lot of information out there available to support or stand behind Lotus births, especially in Western medicine. I did, however, do a little bit of research on practitioners that advocate and support Lotus births. So I'm going to read off some of the benefits that they report come from Lotus births, okay? A gentle, less invasive transition for the baby from the womb to the world. I already spoke on that a little bit. Some say that Lotus birth can reduce birth trauma, and it just reinforces the gentleness of birth. So birth trauma is a real thing. It can also increase blood and nourishment from the placenta, since blood volume is not disrupted, and allows oxygenated blood to flow back into the baby, improving blood circulation. So that's another benefit. It also help improve body temperature, red blood cell count, the immune system, and brain development. Lotus birth decreases the injury to the belly button. It has less of a chance of an infection due to no open wound. It also increases a mortality rate, a higher mortality rate for the baby. And of course, you know, babies' belly buttons are able to heal more perfectly, and it's healing for the mother as well, because the mother being attached to the placenta, you know, it limits her ability to be mobile. And you know, I said earlier that this takes about 3 to 10 days, and usually in the very beginning after giving birth, especially a natural birth, you kind of want to take it slow, you want to take it easy, you want to rest, you don't want to get up, walk around, move around as much. So a Lotus birth supports that. And then again, of course, you know, it's just a spiritual ritual to just honor, you know, the whole birth experience and the baby and the placenta. All right, so now I want to talk to you guys about some of the risks that may be associated with Lotus birth. And the concern is that once you give birth, your placenta is no longer living or circulating, and once it's out the womb, blood stops flowing to the placenta. But we have to keep in mind that this does not happen right away, and it's not automatic. But when it does happen, the placenta becomes dead tissue, And dead tissue is prone to infection, so therefore this could be a risk. And being that the placenta is still connected to the baby becomes at risk for infection as well. But again, if you are a low-risk pregnant woman, you've had a healthy pregnancy, your labor was smooth, you didn't have any complications, then there's really no sign to indicate that your placenta can get infected. Some people will even beg to differ and say that the blood is still circulating and the placenta still being attached to the baby holds a purpose. You know, not only blood but antibodies are being transferred to the baby through the umbilical cord. Overall, since there is so little medical data to support a Lotus birth, there's not enough research as to how to maintain and take care of the placenta, you know, when you leave the hospital and go home and you're waiting for it to detach itself from the baby. Now, that takes it back to the spiritual aspect of this, because some people, I've read that some people have specific herbs. They'll put it in like a little basket with a cloth and they'll have herbs on it. Some people cleanse it. So there's different things that people do, and that kind of falls into their spiritual beliefs. So there is methods out there to maintain the placenta and I guess keep it, I don't want to say keep it alive, but just keep it intact until it separates itself naturally from your baby. Another risk too, you are at risk of injury, you know, so you do have to be very careful. You don't want to rip it or have it get caught some type of way. So if in any way the cord is ripped from the baby, then that is called cord avulsion. I think I'm pronouncing that word right. Along with not having a lot of medical data about Lotus births, you're probably going to find it really challenging to find an OB or a GYN that will support you wanting to have a Lotus birth. Most of them, as well as most of the hospitals, do not really support it. Now, you can do whatever you want, because at the end of the day, it is your birth experience. But when you have these people who are so involved in your birth experience not support you, it'll definitely make it challenging, which is where a doula will come in, mind you, to help you advocate and support your decisions for having the birth experience that you want. Just be mindful that, you know, no healthcare professional or facility can dictate your birth experience. They always have to have your consent. So you want to be mindful of your words, your actions, your body language, because a consent can be recognized in more than just, you know, writing it down, signing something. Now, me personally, because there isn't much Western medical data about Lotus births, you kind of have to research the history of Lotus births. And for me, because there's so little information out there, that also brings the perspective to my mind that there's very little reports of Lotus birth being a dangerous practice. To me, it seems that a Lotus birth has less amount of complications than cord clamping, even delayed cord clamping. Even when they talk about the placenta being dead, there's a huge lack of research in that whole theory. So with no evidence to support this theory, it doesn't necessarily come off to me as a fact. And then on top of the on top of all of that, the fact that this is a very ancient, sacred practice, it just appeals to me more. I guess you can consider me a part of the natural birth world, but it just appeals to me more because this is something we were doing long before Western medicine came along and hospital births became the standard. The only reason that I have found that you would not want to have a Lotus birth is if you plan on using your placenta to make the capsules. Now, when I gave birth the third time, that was my plan. That was my plan, but I did not actually do it. Even though I kept my placenta, I did not actually make the capsules or the little pills for me to take. But it's said to be very healthy for you and for the baby, and just support your body as far as bouncing back, healing, recovering from childbirth, and breastfeeding, and the list goes on and on and on. But I personally did not get to experience that. But I do know for a fact that if you do plan to do that, you cannot have a Lotus birth because you cannot wait until the cord naturally detaches from the baby's belly button. You have to immediately put the placenta on ice, and it has to be done in a very specific way. You have to hurry and get it to the department that is going to make the pills for you. So with that being said, that's pretty much all I'm going to talk to you guys about today for Lotus births. Like I said, this was just a brief, basic understanding of what a Lotus birth is. What are some of the benefits, what are some of the risks, what are some of the things we know about Lotus births, and what would be some reasons you might want to have a Lotus birth. So I hope this video was informative as always. I hope all my videos are informative for you guys, and thank you guys for tuning in to another one of my videos. Make sure you like, comment, and subscribe, and I will see you guys on the next video.